Have you been diagnosed with PCOS and don't know the first thing about how to manage this condition? Well, stay tuned for today's video because we're going to be talking about how to fight PCOS with food. On YouTube, it's Naleen, your Jamaican scholar, and in today's video we're going to be talking about fighting PCOS with food. In my last video, I talked about how I was able to conceive naturally at 34-35 with PCOS, and I got a lot of questions about what PCOS was, and people reach out to me to say that they have been diagnosed with PCOS but they have no clue about how to actually go about managing the condition and being able to achieve some of the things that they would like to achieve. And so in today's video, I'm going to be explaining what PCOS is, what are some of the symptoms, and also how we can have our food be our medicine. So let's get started. What is PCOS? PCOS is actually a hormonal condition that nobody really knows what actually causes it, but it manifests itself in certain ways in women. One, absence of regular menstrual periods. So some women have irregular menstrual cycles. Another way is also very, very long menstrual periods. So having periods sometime for a week, a week is normal clearly, but 2 weeks going on, not stopping sometimes. Some women have elevated androgen levels, which are male hormones. Other women will notice having excess hair growth, having the hair thinning or actually falling out. You also, in hormonal tests, you can actually find that elevated androgen level. But another thing, and one of the most frequent things, is having done a pelvic ultrasound, women find that either their ovaries are enlarged or they have cysts or sacs filled with fluid around circling their ovaries, and in many instances there are multiple cysts of varying sizes that are there. Now, you would if you have been diagnosed with PCOS, chances are you have had a pelvic ultrasound, or you may have had some kind of test that your doctor used to say you have PCOS. Now, clearly they can look at in speaking with you, taking your medical history, they can guess at PCOS, but in many instances your doctors will actually do some sort of test to actually say. So I have had maybe 5 or 6 pelvic ultrasounds in the past 5 years, and in each of those pelvic ultrasounds, I have seen where in almost all of them I've had actual cysts on my ovaries. In one instance, my cysts had ruptured, and so they found a large amount of fluid, but prior ultrasounds had shown multiple cysts on both of my ovaries. Those cysts vary in size, and those cysts don't necessarily stay there permanently. Those cysts can rupture and more cysts grow, but one of the issues that tends to happen is that this causes some women not to ovulate at all, while some women, they ovulate infrequently, which is what tends to result in that irregular cycle. So personally, I had a situation where I had irregular cycles. When I was younger, I would have my period almost every month, but it wouldn't come the same time, so it was all over the place. And then as I got older, my PCOS symptoms actually got worse, and that was when I was actually referred to a gynecologist because I was actually missing I like an entire month I wouldn't have a period, and that was what raised the red flag. And they were saying, yeah, I mean, as long as you were having a period within the month, I mean, that we could live with, but actually not having a period at all, that would have been a cause for concern. I actually did a pelvic ultrasound, and this was when I was in grad school, so many years ago. And the doctors didn't use PCOS. They told me they saw cysts, but there was no discussion of what that meant, or was that something to be concerned about. That was not a part of the discussion. A PCOS diagnosis didn't happen for me until 2017, and so I had been dealing with cysts on my ovaries that would rupture and then more would grow for many years. But PCOS was never mentioned to me as a condition, and I didn't know that this was something that I should be concerned about until much later, like I said, 2017. So some of the other symptoms of PCOS that most people would experience after diagnosis is obesity, excess weight, or weight gain. And I have mentioned before that it is one of the main symptoms that a lot of people with PCOS experience. It doesn't have to happen to you, but it's one of those symptoms that even I experienced, was actually gaining quite a bit of weight, even though people would say, you know, you're small still. And when you look at my history and how small I was, you would understand that weighing 160 pounds was actually quite a bit for me, and that was actually due to PCOS. Other symptoms of PCOS include obesity, weight gain, acne, oily skin, infertility is also one of them, also depression, and a number of other conditions. Actually, PCOS, if left untreated, can even result in type 2 diabetes. And so there are so many symptoms associated with PCOS. You may not necessarily have all the symptoms. I personally did not have all the symptoms. And I can actually go back and look at what were the symptoms that I had. I developed acne as an adult, even when I didn't have it as a teen. I had abnormal hair growth, especially in my face. In my chin area, I actually went and did laser surgery. I had laser surgery 2 times in my life, as in courses of treatment, and in both instances the chin hairs came back, and that of course led to a lot of hyperpigmentation, which also comes along with the acne and the hair growth with persons with PCOS. I did not encounter hair loss. As you can see, I have a lot of hair, but I did have the irregular cycles, like I said, in addition to actually having the cysts, actually having the hair. And those were probably some of my major symptoms, in addition to just extremely painful periods, which was really a combination of my PCOS with my endometriosis. And just to briefly define what endometriosis is, and this is the endometrial lining that is supposed to be inside of your uterus. Those cells are actually growing outside, and that can actually spread to, for example, your kidneys, your bladder, which happened to me. And what that means for women is that lining that grows and falls away at the time of the period, that lining is growing outside, so it exacerbates your menstrual symptoms. And endometriosis is another thing that a lot of women that have PCOS tend to have, and actually increases the whole likelihood that if left untreated, you could be considered to be infertile and have issues actually conceiving. What are some of the complications that are associated with PCOS? I did mention infertility because it is one of the most common issues that women with PCOS struggle with. One of the Other complications, as I mentioned, is type 2 diabetes, also depression, I mentioned as well, and there is also intrauterine cancer that you can develop as a result of PCOS, and that is of course extremely serious. Other complications include an increased risk for gestational diabetes and premature birth. How is PCOS treated? Well, PCOS is really treated by dealing with the individual symptoms. Um, Doctors may prescribe, for example, birth control pills. They might prescribe, as I mentioned on my last video, metformin. They might also do periodic tests for diabetes or high blood pressure, since those are two things that are, you're at an increased risk of those two things when you have PCOS. Or they may, for example, electrolysis or something else to deal with your unwanted hair, etc. But really, they tend to focus really on the symptoms. And when you read online about PCOS, one of the things that you're going to hear over and over again is losing weight is one of the ways that is highly recommended. And of course, that goes hand in hand with controlling your diet. And the truth is, when you are managing your weight, your PCOS symptoms will tend to go tend to reduce naturally. But not just that, but if your doctor is going to prescribe medication for you, then it is likely that those medications will work better if you are actually losing weight. Other medications that doctors might recommend, if you are not ovulating. I'm one of those persons who was ovulating fairly regularly, but if you are not ovulating, they might recommend Clomid or some other medication to actually force the body to actually ovulate. As I mentioned before, the 3 ways that are strongly recommended for managing PCOS are actually being active, lessening carbs, and losing weight. Since managing PCOS, one of the most important things is to maintain a healthy weight, we have to talk about how we eat, because as the saying goes, abs are made in the kitchen. Now, this is definitely true for somebody with PCOS. Managing the condition is going to be more than just medication or even exercise. The most important thing is going to be your food, because for the most part, you will find that your food is a huge part of your medicine. So let's talk about managing PCOS with food. Now, limiting carbs is a very simplistic way of saying that you do need to manage your blood sugar, because one of the things that tends to happen with people with PCOS is insulin resistance. So the body is not necessarily releasing insulin to process sugars as well, and so you tend to have higher blood sugar. And higher blood sugar, of course, sustained higher blood sugar is what causes you to be diagnosed with type 2 diabetes. Now, what it means then is that you have to be cognizant of sugars. And sugars are not just sugar in your food, as in the sugar that you add or eating or drinking sugary foods, but also managing the glycemic load that you are actually ingesting. Now, each food has a glycemic index and a glycemic load. And I was specific about saying glycemic load because the glycemic index tends to be simplistic, meaning a food might have a high glycemic index, which talks about the amount of sugars, natural sugars that are in the food, right? And a food might have a high glycemic index, but you would have to eat a lot of it in order for your blood sugar to be affected negatively. So a normal serving size of that food is fine. And so you want to make sure that instead of looking at glycemic index, you look at glycemic load. So glycemic load looks at not just the sugars in the food, but sugars in the food, and how much of that food is a normal serving size and how much sugars would be in that normal serving size. And so managing the glycemic loads. Now, I mentioned in my last video that that means managing simple sugars and simple carbs. And in fact, what you tend to do is to cut those out as much as possible. So, whole wheat flour, yes. White flour, no. Sweet potato, yes. Irish potato, no. So normally we say anything white is simple carbs. We want to go for more complex carbs. And why do they say simple carbs or recommend complex carbs as opposed to simple carbs? It is because complex carbs take longer to process in the system, and so the effect on your blood sugar is not as dramatic. Foods that are simple carbs, what happens is that the body processes them very fast and your blood sugar spikes. Higher blood sugar means that you actually get hungry faster and you go ahead and eat again. And so not only is it elevating your blood sugar, but it's making you hungry faster, so you're eating more foods. Complex carbs take longer to process in your system. You stay full longer, right? And that is what they want. They want for you to do. You want for the food to take a little bit longer to process, for you to stay full longer, and for your blood sugar not to shoot up, not to spike, because that's what helps us. That's what tends to send those messages to our brains to say eat more, eat more, eat more. So more binge eating, actually, which is definitely not good for somebody with PCOS. So simple carbs, no. Complex carb, yes. So I mentioned a lot more oatmeal, for example, a lot more whole wheat options. In fact, I cut out, for the most part, dumpling eating when I was really working on getting pregnant. Now I am more moderate, and so that's something that I would say moderation in kind of like your habits. But if you have a goal, for example, getting pregnant, then you probably want to just not do those things. I was eating bulgur instead of even rice. So if I was gonna eat rice, it would be brown rice, but mostly I would be eating bulgur. I would be eating pumpkin. I would be eating sweet potato, not so much yam, right? I would be eating green bananas as my carbs. And one of the things that my nutritionist taught me was what is a normal serving size, because portion control is the other part of the equation that we don't talk about. So we might be thinking, oh, I'm eating food, so I'm not going to eat a whole heap of rice, I'm going to eat ground provisions. And even if you're eating the right ground provisions, how much of the right ground provisions are you eating? Because if you are going to be eating 6-finger banana, that is too much, right? In fact, you have limitations on the number of servings that you're supposed to be having. So if you're eating more than, say, 2-3 fingers of banana, you have exceeded the amount of carbs that you're supposed to be having on your plate as somebody with PCOS, right? Even when it comes to fruit, I mentioned on my last video that I was eating more tangy fruit, but that's just a part of it. For example, it's mango season and you're going to eat a mango. For example, you eat a Julie mango. Under normal circumstances, a Julie mango is considered a whole meal. And so you have eaten a whole meal. So if you eat 3 Julie mango in the night, right? After you're done eat your dinner, you've just added 3 meals to the 3 meals that you ate today. So what my nutritionist was able to show me was, how many meals am I supposed to be having? 3 meals with snacks in between. And those snacks are very specific things. So if you're eating, for example, a whole wheat dumpling, 1 dumpling. If you're going to eat brown rice, 1 cup, and you have to actually measure a cup. So you begin to start seeing that your food can be your medicine, but you have to be very, very dedicated to how you are putting together those meals, because that is something that is going to definitely impact how it plays out in your body. Also, they recommend increasing your protein intake. Normally, it is said that half of your plate should be veggies, the next quarter is protein, and the next quarter is the good carbs, right? The complex carbs, the high GL carbs. And that is what you should be looking at. High glycemic load carbs, right? Nothing that is too high in sugar. Now, I know that for my Jamaican friends, they're probably like, what you're saying to me? I can't eat mango, I can't eat pineapple, I can't eat. The truth is, you can have them, but if you're going to have a mango, you probably need to have a slice of a mango, not a whole mango. That is just the truth of the matter. One of my friends actually said, old age is no fun. PCOS is becoming the teacher, and you are now the student of your body, and you have to learn how to actually be comfortable in your skin with this condition. And it can be done with your food, right? And so that is why I chose to start off by talking about fighting PCOS with food, because I believe that once you address your food, then you can then start with the fitness. But it doesn't matter if you're in the gym working out if you are not eating right. You're not going to see any results, right? So in order to see the improvements in your body, you should be first focusing on your food. Another thing that you should be looking at, as I said, is cutting out sugary beverages, and also high caffeine. So for example, coffee, right? I am somebody who actually needs to have at least 1 cup of coffee per day, and I do have just 1 cup of coffee per day. And I have my 1 cup of coffee black, no creamer and all of those things. For the most part, I have my 1 cup of coffee black with 2 teaspoons of sugar, and that's all the added sugar that I will have for the whole day, right? I drink lots and lots of water throughout the day. I try as best as possible to stay away from the sodas, even the fruit juices, because remember, if you're drinking fruit juice and you're eating fruit, you're adding to the servings of fruit that you're eating per day, and you're only really supposed to have 2 to 3 servings of fruit per day. And a serving of fruit is like a banana, 1 single ripe banana. That's a serving of fruit. So you want to be picking, right? And I mentioned bananas, and bananas are actually great because bananas are high in magnesium, and that's one of the things that people with PCOS tend to try to increase in their body, magnesium. To recap, one of the main ways that we are going to manage our PCOS is to manage how we eat, and that means low carb diet, low GL foods, portion control, reduction in simple sugars and added sugar to our diet, increasing our hydration, drinking lots and lots of water. One of the challenges that women with PCOS have is that many doctors don't have a lot of information on the condition or how to treat patients with the condition. A lot of the recommendations tend to be medication based, so whether it is metformin, clomipene, or something else that they give you, that's just one side of it. The truth is, managing PCOS is much more than medication, and in fact, you might find that you're able to manage this condition by just some lifestyle changes. Now, clearly, I am not minimizing the challenge that PCOS presents, and there are some women who definitely do need medical intervention, like medications, like surgical procedures. And so I would strongly recommend that you see a reproductive endocrinologist if you have been diagnosed with PCOS, so that a holistic course of treatment can be developed for your condition. I hope you enjoyed today's video and learned something new. If you are managing PCOS and would like for me to discuss a particular topic, please put it in the comments below so that I can take that into consideration when I'm recording my next video. If you are new to this channel, please consider subscribing and turning on notifications so that you will know when I post a new video. Again, I am sending positive vibes to all the women who have been diagnosed with PCOS and are battling this condition. I am on this journey with you, and I cannot say that I have won. It is a constant fight. Now that I've had my son, I have to get back on the train again to continue to manage these symptoms, because not because you've had a child once with PCOS, that doesn't mean that if you try to have another one, there won't be any complications. It is an ongoing process, a fight that I hope that we will all continue to have with this particular condition. So that's it for today. Nelline here saying, walk.